Hello, my name is Derek Enlander. I'm a physician in practice in Manhattan, New York, and I've got a particular interest in ME, myalgic encephalomyelitis, commonly known as chronic fatigue syndrome. Today I'm going to talk about use of supplements in ME. About 20 years ago, Cutipressin was a supplement that was first used in ME. Cutipressin is an FDA-approved complex porcine liver amino acid extract, and the substance was actually injected at least once a week to patients suffering from this condition. Unfortunately, it had a relatively minor effect when given alone. So we experimented over the past 15-20 years with adding some supplements to the Cutipressin. We added methylcobalamin, folic acid, glutathione, magnesium chloride, magnesium sulfate, calfazan, trace metals, zinc and molybdenum. And we find actually that by complexing these other supplements, we got a better result. In talking actually about our methods, a friend, Rich Van Koyenberg, who unfortunately passed away a couple of months ago, talked to me, this was over a decade ago, about how to give supplements to improve the methylation cycle, where he thought the defect lay in this condition. In the methylation cycle, he actually said that what we actually had added to the Cutipressin mix made actually sense from his theory about the methylation cycle defect. He said actually that maybe we should try and add more glutathione, as patients seem to have a lack of glutathione. So he actually suggested adding glutathione with L-cysteine in the form of Immune Resist. And we actually give the capsule Immune Resist in the morning. Unfortunately, glutathione is very poorly absorbed, so we have to actually give it with the L-cysteine, which is contained in the Immune Resist. He actually also suggested that we needed to add folinic acid to our list of supplements. So we found actually Immunoplus substance, actually a capsule which contains actually, amongst other things, it contains the folinic acid, which Rich thought would be helpful, and indeed it has. In order to actually get the methylation cycle running, you need a surplus, an excess of vitamin B12. B12 also is poorly absorbed if given orally. So most people actually take B12 by injection. However, most people actually don't like injections. So therefore we find actually that the sublingual B12 in the form of methylcobalamin was actually an ideal method of administering B12. We give this spray daily, and it actually is a great supplement. Unfortunately, with this condition, we have some severe memory loss and concentration loss. This actually can be supplemented with Catapult. And Catapult actually is a capsule which contains cat's claw and picamillion, and this seems to actually help patients with their memory loss and concentration loss. In addition, some patients have problems with muscle pain and muscle fatigue. Blasi in Barcelona find that if one added a combination of electrolytes, potassium, sodium, calcium, and magnesium, that this actually helped the muscle pain and muscle fatigue. He actually had a substance called recuperation or Recup, which is obtainable in Europe. Unfortunately, it's difficult to find in the United States or in Canada. So we actually have found a substitute called Electrolyte, which also contains potassium, calcium, magnesium, and sodium. These are in the correct ratio so that proper absorption is performed. The electrolyte tends to relieve some of the muscle fatigue and muscle pain. I hope actually these few words have been helpful to you, and some of the ideas of supplementation should actually be attributed to our friend Rich van Koinenberg. I thank you very much.